when Wendy and the people at Holistic Dental Center asked me to speak about toxicity, I said, you know, that's great because I just put together this 12-hour presentation. And then she said, you only have 15 minutes. I said, 15 minutes? How am I going to do this in 15 minutes? She says, it's a very sophisticated crowd. So we're going to give you an overview of some of the things that I do as a naturopathic doctor, and I'll explain what a naturopathic doctor is first. But looks like there's a lot of letters after my name. But essentially what I do, I'm a physiological detective. I want to know why. Why are people having the issues that they're having, rather than just suppressing a problem? Giving a drug that's not making you healthier, it's just making the symptom disappear. But I want to know why. I want to know the underlying reasons why people are having their issues. What is naturopathic medicine? I am not an alternative doctor. Because eating right, taking the right type of nutrients, thinking properly, exercise, could never be the alternative to good health. How many drugs does a healthy person take? Thank you. Drugs and surgery are the true alternative. So if people are not living appropriately, drugs, and I'm not saying drugs are bad, and sometimes drugs are absolutely necessary. But my job is to evaluate why individuals are taking multiple medications, and are there problems associated with those medications? Are they developing toxicities because of those medications? And what can I do as a holistic doctor, functionally, to be able to bring somebody into optimal health rather than just suppress the symptoms? Basically, we're going to be talking about what is toxifications, what are the symptoms, what do we need to detoxify, who should detoxify, how we should detoxify, and what does a detoxification treatment plan look like. Basically, detoxification is the overload in the body. The body is intended to be able to detox our liver, our colon, our kidneys, all of these organs, if they're working effectively and we're not overloaded, are intended to be able to reduce these toxins. But we're living in a different world. Dr. G emphasized that in his talk, that our environment is not what it once was. Life was a lot simpler 1,000 years ago. Well, maybe not. Maybe not. They didn't have cell phones. How do you call your friends from the other cave? In your folders, you have a sheet of paper. It says detoxification indicators. Many of the diseases, conditions, symptoms that I see are really the result of excess toxicity. So what are toxins? Any substance that actually creates an irritation or has a harmful effect on the body. And this could be from water, food, air, cosmetics, plastics, just drinking out of plastic bottles, and we'll get into that. So our food supply, the use of pharmaceutical drugs. Anybody who's taking 3 or more pharmaceutical drugs, there's virtually a 100% chance that not only are those individual drugs possibly causing some type of significant side effect, but the interaction of those medications with each other are causing the body's inability to deal with it. And obviously, long-term effects of toxins could have profound physiological problems, including those areas that affect the mind. I would say a very high percentage of the patients that come to me with anxiety and depression, autoimmune conditions, it's the result of long-term toxicities from the air, from the water, fish, as Dr. Gashinsky spoke about, mercury in our fish, such as swordfish, shark, mackerel, tuna, sea bass, canned tuna. We can add to that marlin. Love marlin. Anybody ever taste marlin? It tastes like pork chops, actually. I'm not eating pork. How would I know this? Farm-raised fish, salmon, tilapia, trout, and catfish, they actually swim in these bins where they're swimming in their own feces. And farm-raised fish are eating a very unnatural diet. They're fed grains, they're fed corn. Thank you. And they're also treated with antibiotics and chemicals to make them grow faster, hormones. The fish that are lowest in mercury, your salmon, your crab, your haddock, your pollock, your flounder, trout. You can also add to that sardines, anchovy, herring, and mackerel. The smaller fish. So I get all these people that are helping me along, just in case I forget something. I need that. I'm used to teaching in the classroom because I do lecture at Rutgers Medical School. I lecture at Montclair University. So it's great to have that interaction, and I actually appreciate it. Pesticides in food. You know, we can't escape. We're living on the planet. We've essentially destroyed the planet in many ways. Our food is denatured. Our seas are toxic. If anybody has taken a cruise and they see all the toxins in the oceans, and this is where we're getting a lot of our seafood, it's actually been determined that fish caught above Greenland, where nobody lives, have had toxic elements, PCBs and mercury. How does it get there? This is actually the Dirty Dozen. Anybody that's familiar with that, these are the 12 fruits that have the most pesticide residue. Particularly, I want to be able to pay attention to strawberries because of the porosity of a strawberry. No matter how well you wash a strawberry, you're not going to be able to get the toxins out. And I always tell my wife, do not buy strawberries if they're not organic. I will throw them away. Is that true?
Yes.
That's my, raise your hand. That's even foods that you think are healthy can be toxic to you. If you're sensitive to a particular food, it's going to have a toxic reaction. Take, for example, with dairy with many people, lactose intolerance, gluten intolerance. 65% of the patients that actually come to my office, I deem as having a gluten sensitivity. 65%. And I'm not talking about people that just have celiac disease. I'm talking about people that have an intolerance to gluten that's making, it's not only causing toxicity, but it's actually rendering their body inefficient where they cannot detoxify appropriately. Home products, things at home, mercury amalgams that we had spoken about, different types of toxic compounds that we're all exposed to. So we can't eliminate all of these things, but we want to be able to do the best we can. We're not going to be on one of these spaceships that are going to be headed towards Mars to be able to escape the Earth's crust. But to be able to do the best we can with what we have, but first we have to determine what is the toxic load in the body. And there's many ways of establishing that. Find out the health history, what kind of exposures have you had, support the detoxification organs, the digestive system, the colon, the kidney, the skin. You want to be able to make all of the organs of elimination much more efficient. The way the ways that actually assessing these is by looking at their level of exposure, whether they're a smoker, are they in an occupation that they were exposed to in the number of toxins, like the printing industry. I do a hair mineral analysis. Amazing. I'm getting a tremendous amount of information just by analyzing hair. Because hair is basically like doing a biopsy of your body tissue. Urine provocation analysis, solvent and pesticide testing that we can do from blood serum, and liver function testing. The primary organs of elimination, the digestive system, the kidney, the lungs, the lymphatic system, and the skin is the largest organ of elimination. And I really like sweating and vigorous exercise and saunas, which are great. So we want to make sure that each one of these organs are functioning optimally, even before we consider doing a detox. The liver, the primary organ of elimination. It's involved in 500 different functions of the body. It has to excrete the excess hormones, it has to excrete all of the toxins. But the liver gets overloaded. It gets overwhelmed. So we have to work on that. The digestive system. The gut is the core of where we have to really focus in on when somebody has multiple problems. That's the first place we look at. And being able to look at nutritional insufficiencies, bacteria, anybody who has bloating. Anybody who's gas and bloating, they've got small intestine bacterial overgrowth. I don't even have to test for it. If you've got bloating, you've got overgrowth of bacteria. We've got to deal with that. So in repairing the gut, we're looking at the 5-point plan. Rebalance, diet modification, really look at what kind of food sensitivities we have, remove any pathogens that are present, H. pylori, candida, replace hydrochloric acid, digestive enzymes, and fiber, and we can really make an analysis of if somebody is hypochlorhydric or low stomach acid. Reinoculate with probiotics and prebiotics, which are fructooligosaccharides. You didn't think I would be able to say that word, did you? Or inulin. And repair with appropriate nutritional supplements, including antioxidants. Now, antioxidants, what is the main function of antioxidants? To either neutralize or reduce the level of free radicals. Well, this is not exactly what I was talking about with free radicals.
That's free speech.
That's free speech. They're a little more radical. But this is what I'm talking about with free radicals. Talking about which apple are you going to eat. This apple was exposed to oxygen, it's become oxygenated, free radical damage, degradation of the apple. This apple was preserved by putting it in lemon juice. Now, what's lemon juice? Lemon juice is an antioxidant. And I'm getting the motion that I'm taking too much time here. So we have to optimize our ability to eliminate these toxins. How do we do it? First of all, we've got to look at a number of different factors. How do we, let's use common sense. Let's not walk around our house after we've walked in the field, walked in the street, walked on the sidewalk, and then take our shoes off before you enter the house. Non-toxic cleaning materials. Look for green cleaning materials, detergents, soaps, etc. Don't use insecticides, herbicides in or around the house. Non-toxic, use non-toxic dry cleaning. Now this is really interesting because even mild deficiencies in nutrition, because that's one of the things that I try to assess with everybody, is what are the nutrients that you have certain deficiencies or imbalances to. And everybody has biological individualities. So we have to really pay attention to what does the body need. And one of my favorite quotes is the RDA, the recommended daily allowance, is the nutritional equivalent to the minimum wage. So, you know, people saying to me, hey, you know what, you're giving me 10 times the RDA. Diet, nutrition. These are common sense things, just being able to look at what things can actually improve your energy. Look, seasonal suggestions, things to eat at various seasons. Cruciferous vegetables, good for the liver, dark green leafy vegetables and beets. Just a few ideas on nutrition, lifestyle things that can actually improve our ability to detoxify. 30 to 60 minutes a day of good exercise. Yoga, breathing exercise, massage, fiber, flax seeds, hydrotherapy, and nutritional supplements, various that, and I use nutritional supplements as needed by each individual. So nobody gets a standard protocol. Everybody gets what I feel is going to be most effective for that particular patient. Amino acids, liver herbs, and again, this is if somebody actually needs that, and I'll put together custom formulations specifically for each one of my patients. Related websites, if you're interested in, and some of the suggested books. I've got lots of books, but these are some of my favorites in detoxification. One other point: when do we detoxify? We should always be thinking about detoxification. Every day we should think about what can we do to not bring toxins into our body and to be able to lessen the load. But my wife and I do about 3 or 4 serious detoxes throughout the year, and we feel great. My patients, when they do a detox, I love it when I put somebody on a detox, because I know they're going to come back to me and say, I haven't felt this way in decades, or I've never felt this way. So being aware of how your body works, what we need to do to remove these toxins from our body. We can't move from the planet. We can't avoid all the toxins that we're exposed to, but we can do the best we can to make us better selves. Thanks a lot.